Understanding heart murmurs doesn't have to be about memorization or mnemonics, it's really about understanding blood flow. Let's break down systolic versus diastolic murmurs using the normal cardiac cycle. So first, let's recall the basics. Here is a heart and all the valves are labeled, so the tricuspid, pulmonic, aortic, and mitral valves are all labeled. And during systole, the ventricles contract, pushing blood out of the heart. So again, we see from the right ventricle through the pulmonic valve into the pulmonary artery, or you have from the left ventricle through the aortic valve into the aorta. So the aortic and the pulmonic valves are open because obviously blood is supposed to flow through them, while the mitral and the tricuspid valves are closed because you really don't want blood going backwards during systole. You want it always to go forward flow into the pulmonary artery, into the aorta. And then the diastole is exactly the opposite. So during diastole, you have blood flow from the atria through the tricuspid valve into the right ventricle, or from the left atrium through the mitral valve into the left ventricle. Again, the aortic and the pulmonic valves in this case are closed because again, you don't want blood going where you don't want it to go. And so during diastole, you really want the ventricles to fill up so then you can have a coordinated squeeze during systole. So a murmur occurs when blood flow is turbulent. This is usually across a valve that shouldn't be open, that would be regurgitation, or it's narrowed, that would be stenosis. Systolic murmurs happen between S1 and S2. S1, as a refresher, is a closure of the tricuspid and the mitral valves, and S2 is a closure of the pulmonic and the aortic valves, which makes sense since the ventricles are contracting. So S1, you have the closure of the tricuspid and the mitral valves, and then you have squeezing of the ventricles, which sends blood through the pulmonic and the aortic valves, which makes sense because you want the blood during systole, when the ventricles are contracting, to go forward. You want it to go into the lungs and into the body, and you don't want it to go backwards into the atria, which is why you have closure of those valves. And obviously the pulmonic and the aortic valves are open because you have blood flowing through them in a forward motion. And S2 is just the closure of the pulmonic valves and the aortic valves. And this makes sense as well because during diastole, which is between S2 and the next S1, you have blood flowing from the atria into the ventricles. And so you want the blood to be able to actually fill up the ventricles before they have that coordinated squeeze during systole. So up here we have examples of a systolic murmur. So we have the waveform, which is the squiggles, and that is going between S1 and S2. And then during diastole here, you have absolutely nothing. So you may see this on a question where you have this diagram and they ask you, where is the murmur happening? And then first you have to be able to identify that this is systole because it's between S1 and S2. And then going back to our diagram here of the heart and the labeled valves, what we see during systole, again, the ventricles are squeezing. They really want to pump out that blood, and they send the blood through the pulmonic and the aortic valves into the pulmonary artery and the aorta. You have this forward flow. So if you have stenosis of the pulmonic or the aortic valves, you have a narrowing of the valve, and so you're going to get a systolic murmur from that. Or what you can also have is from the ventricles, they squeeze really, really tight, and they actually overpower the tricuspid or the mitral valve, and they actually squeeze blood through those when they're not supposed to. That's not a functional heart that's working appropriately. You really don't want it to go backwards. So that's why it's tricuspid or mitral regurgitation. Since this is going backwards, it's not what it's supposed to be doing. We call that regurgitation rather than stenosis. So stenosis is when it's going in a forward motion. It's going through a valve it's supposed to be going through, but the valve is too narrow. Regurgitation, on the other hand, is when it's going through a valve it should not be going through. The valve should be closed, but for some reason it's leaky, and so what you get is regurgitation. So diastolic murmurs happen after S2 and before S1. This is when the ventricles are filling. You have blood flow from the atria into the ventricles. So here the turbulence is due to two reasons. You could have stenosis of the tricuspid or the mitral valve, because again, it should be going through those valves, or you have regurgitation of the pulmonic or the aortic valves. So we see here during systole, you have no murmur. That's why there's no waveform. Same thing for this systole, but during diastole, you do have this waveform. And again, you may see this type of figure on a question, and you have to identify that here's S2, here's S1, this is where the murmur's at, and so that's why it's a diastolic murmur. Going back to our diagram here, we have blood flow from the right atrium through the tricuspid valve into the right ventricle. That is during diastole. Same thing on the left side, from the left atrium through the mitral valve into the left ventricle. That's diastole. So that's what's supposed to happen. So if you get stenosis of the tricuspid or the mitral valve, you're going to have a murmur that is diastolic because it's supposed to be going in a forward motion there. What you can also have is during diastole, if you have regurgitation, so backwards flow from the pulmonary artery through the pulmonic valve into the ventricle, that would be a diastolic murmur. Same thing for the aorta. So you have backwards flow from the aorta through the aortic valve into the left ventricle. That would be a diastolic murmur. So just to reiterate, because repetition is key, we think about blood flow, what should be happening, and is this a valve that should be having blood through it? And if it's not, then it's regurgitation. If it is, it's stenosis. So for systole, again, from the ventricle through the pulmonic valve into the pulmonary artery, that would be stenosis, correct? If you have backwards flow through the tricuspid valve, it shouldn't be going through that. That would be regurgitation. So to tie all of this together, if you have a systolic murmur, so you identify that on either the graph or the timing, or they tell you it's a systolic murmur during the physical exam, then you know it is not tricuspid stenosis, because this is backwards flow during systole. You know that. You know it's not mitral stenosis because it's backwards flow. By definition, those are going to be regurgitation. Same thing for pulmonic and aortic valves. You know that it's not going to be backwards flow through the pulmonic valve because the ventricle is squeezing. Same thing for the aortic valve. So you know if it's a pulmonic murmur that is during systole, is going to be stenosis by definition. So the pattern is pretty simple. During systole, you're going forward through the aortic and the pulmonic valves. That's going to give you stenosis. And then you're going backwards through the mitral or the tricuspid valve. That would be regurgitation. You would never have a systolic murmur that is mitral stenosis. That is not going to happen. That is not how the valve works. And so you really have to think about it in this way. Where is the blood supposed to be going? Looking at diastole, you have diastole from the atria into the ventricles. So the aortic valve and the pulmonic valve do not have blood flow normally through them. So that would be regurgitation. And then mitral and tricuspid valve, you do have blood going through them, so that would be stenosis. They're just so narrow that you're actually causing turbulent blood flow, and that's going to cause a diastolic murmur. So I really want you to focus on flow, not memorization, not some mnemonic. So understand when the valves are open and closed. During systole, again, the pulmonic and the aortic valves are open because you want blood to go through them. And then the tricuspid valve and the mitral valve are closed during systole because you don't want blood going through them. So if there is blood going through them, then you're going to have, again, if it's tricuspid or mitral valve, that's going to be regurgitation because you don't want blood going through. If it's pulmonic or aortic valves, you do want blood to go through them during systole, and so that's going to be a stenosis. And then the opposite for diastole. So here's a list, again, of systole and diastole and which murmurs occur during which. Again, during systole, you are never going to have aortic regurgitation. That's just not going to happen. It's always, if it is the aortic valve, it's going to be aortic stenosis. And I know that this is not helpful to identify, okay, I know it's a systolic murmur, so which one is it? Is it aortic stenosis, pulmonic stenosis, mitral regurgitation, or tricuspid regurgitation? It really could be any of them. And so you're going to have to look at the rest of the question stem, which I'll have another video later about, which is going to identify, okay, where was the murmur at on physical exam? Do they give me echo findings? Do they give me other things? Let's, for instance, syncope or angina or dyspnea, which may point to aortic stenosis, or they may give you a history of rheumatic fever, which would be more like mitral valve issues. And so that's really what you want to identify. But first and foremost, you need to be able to identify, okay, it is a systolic murmur. That means it's one of these four. That's so important because they're going to give you free questions that will have answer choices that are going to just not make sense. It's going to be a systolic murmur and they're going to give you an answer choice to tricuspid stenosis. That's never going to be the answer for a systolic murmur. So you can just cross that answer choice off. And this is really, really helpful to make sure you're not missing free points or getting rid of free answer choices that you should never pick. So hopefully this video was helpful. I really think that understanding things rather than memorizing or coming up with mnemonics is helpful. There's certain topics that obviously memorization is important or maybe just needed, like infectious disease or antibiotics, microbes, things like that. But this is really not one of them. This is something that you should core and fundamentally understand about how the cardiac cycle works, which valves are open and closed, and which murmurs are going to occur and why they occur. Because a systolic murmur, that is stenosis, has a completely different pathology than a valvular systolic murmur that's going to be a regurgitation. Just the pathology is completely different, so it really helps to understand the why. So again, I hope this video was helpful. Please let me know in the comments if there's other topics that you want me to discuss. Hopefully see you in the next video.